Rosa, how do folk get in touch with you? I'm going to jump back and forward a little.
Me personally, through customer services, no. So orthotics, it's accessible. NHS is difficult at the moment, so obviously acute orthotic referrals are still being managed. So if it is neurological, any sort of brachial plexus injury, that sort of thing from a fall trauma, that will be managed and will be seen just through the normal NHS setting. However, normal clinics aren't up and running sort of in a set where you say 10 patients an hour, maybe. Not an hour, sorry, a clinic an hour. That's a consultant, you say 10 patients an hour. 10 patients a clinic, you are now limited to 1 an hour. So it's 3 down from 10 to 3. So that is going to have an absolutely massive knock-on effect. So I think more and more you're seeing people sort of tapping into private orthotic referral, and there are clinics sort of nationwide that are now have the protocols and the sort of safety guidance to be able to see patients face to face. And I think with certain conditions and certain presentations, shoulder being one specifically, you really orthotically need to see patients. You can't do it sort of virtually. You need to have things to try on. You need to mimic things up with tape. You need to try on your universal shoulder shrug and see the effects it has, so that you kind of are limited when it comes to shoulder. There are certain things, if you move down a little bit further to elbow, epicondylitis, patients are self-managing, they know how it works. A few simple tests, you can diagnose whether something like an epicondylitis grasp may help alongside physio. It's part of the picture. So I think patients are getting more and more empowered to sort of really try and rectify their problems themselves and seek their own referral when they can't access it through the NHS. But I say virtual clinics are sort of increasing in number sort of on a daily basis, NHS setting wise, which is really positive.
And now the question you were expecting, have you got a case study that talks about shoulder issues? I'm just trying to keep you on your toes.
Which I got from a case study point of view, I think the most recent one I dealt with before I moved role was a patient with FSHD, and he was a train driver, so really, really bad scapular winging, and needed to be able to move fairly well to do his job. And we fitted him up with a bilateral lycra vest. Not a very attractive thing. It was really high to get sort of really good control. It didn't do massive amounts. I didn't personally think for his shoulder winging, but it was amazing the difference it made for his pain level, and that was what he needed to maintain his function, and it needed to maintain his sort of his livelihood effectively. And he's worn it for sort of a couple of years now. He's broken the zip a couple of times, but that's nothing that we can't fix and get him a sort of spare one. But the difference it made, more from a pain management point of view necessarily, rather than it was wonderful and it pushed his scapulars right back into the way we wanted them to be and sort of solved all his problems. It was that versus him going down the route of looking at scapular fixation, which he was really not sure about. So as an interim measure, it served him really well. And so I think it's positives to take from, even though there's not a lot of evidence behind it, actually in the right patient and with the right trial set up, it can be really effective and a really good intervention.
Excellent, thank you. And you've said something there which links back to what everyone else has said at some point or other tonight. It can be that small goal. We used to base treatment plans and patient-guided, patient-centered treatment plans on the big goal, but it can be that small goal which makes all the difference, especially in neuro and things like that. We've actually had a compliment from a physiotherapist. I'm a pain management physio, and it's lovely to hear that you're working collaboratively and holistically. That's what these guys are all about.